All right. Good evening, everyone. Thank you very much for joining us tonight. I'm Tim Pecoraro, Superintendent of Pattonville, and we're really excited to welcome you to tonight. We're going to do a COVID-19 update along with an update on the CDC project we've been working on. Very excited again to be joined by Dr. Jason Newland, who's an infectious disease specialist from Washington University. We've been working with Jason. It's hard to believe it's been over 6 months now, going on 7 months. And we really appreciate the guidance he's provided us as a school district as we've navigated the pandemic. And tonight's an opportunity for him to share some results of our first study. He's going to talk a little bit about the vaccine and then also just a lot of things COVID related. So if you have questions as Dr. Newland's going through his presentation, just use the chat function and he'll answer some questions as either we go through or towards the end. So at this time, I'm going to turn it over to Dr. Newland.
Thanks, Tim. So I will share these slides. Tim, are you seeing the actual slides? Okay, so thank you. I really appreciate this, Tim, Dr. Pecoraro, for this opportunity. I can't express enough to you all that are here tonight and to the whole Pattonville community for the support and partnership collaboration with this project. Your efforts, both when we initially started back in December and even beforehand, as well as through the January through March project, has helped change the national policies around school and COVID-19. Like you guys, your efforts are right there. And so that for me, the CDC and others, we can't thank you enough. And schools around the country should be thanking you because there's no doubt that the reason 3 feet is acceptable now is because of the work done here in Pattonville. So that's hands off to you. Now, with that, I'm going to start and talk about vaccines first because it only gets more and more exciting to talk about vaccines. You all probably know and definitely know that the Pfizer vaccine as of last week was approved, or emergency use authorization was approved down to 12 years of age. Being a father of a 15-year-old who was the last member of the family to be vaccinated, who was begging me to say she was 16, she was much relieved to get her first dose on Friday. The side effects from the study to approve this basically showed the same thing that the adults have been experiencing, especially after the second dose, which is kind of, feeling achy, tired. I personally felt achy and tired and took a nap and went to bed early, and the next morning felt fine. You should also know that Moderna, so that's this next one, that's similar to the Pfizer vaccine, has ongoing clinical trials. My understanding is they've finished their study or their enrollment for their 12 to 17 year age group. So maybe we'll hear about that soon. And I can tell you that soon in our own community, we will be doing some Moderna vaccine trials for the 6 to 11 year olds. So Moderna will also have it. Johnson & Johnson is the third vaccine approved in the US. It isn't clear if they're even going to do pediatric trials because I think 2 reasons. One is Pfizer and Moderna are so far ahead of them. And second, with the 1 in a million risk of the clotting issues, it's going to be harder to enroll children in those. There's other vaccines that are in the pipeline, and even there's vaccines in the pipeline, including a nasal one. So not a shot, an intranasal one that potentially will roll out with trials in the coming year or so. So I want to just give you a real brief look at the vaccine in the real world setting. All this data is based off clinical trials where it's looking for people who actually have COVID-19 symptoms. This was a publication that came out at the end of March that basically what this trial did is they did 2 things really. One is they took a bunch of healthcare workers, about 4,000 of them, and they tested them weekly. Now you might be saying, well, Jason, why do I care about them testing it weekly? Well, the reason we care is because it's looking for asymptomatic infection. Because before, all you knew was if someone got sick and they tested positive for COVID-19 in those trials. And in this trial, not only did they follow them weekly, They also then looked at what happened if you only had one dose. Now, I want to first be clear to all of you is I'm not advocating for just one dose. Get both your doses. But here's what they found. Those who were unvaccinated among these healthcare workers, there was 161 infections. But if you were fully vaccinated with 2 doses, there was only 3, which basically with the math turned out to be 90% effective. If you only had 1 dose and you were 2 weeks out, it was 80% effective. Now, that's important to say, look, in the real world setting, this is still a super effective vaccine. And there's other data where if we look at the number of breakthrough infections among all vaccinated, so that's both Johnson & Johnson, or all 3, Johnson & Johnson, Moderna, and Pfizer, there's only about 6,000 infections among 120 million people that have been vaccinated. So if you do the math on that, it's less than 0.05% of breakthrough infections. I mean, that is remarkable vaccine effectiveness. So I think that's super important as we, go forward and how effective vaccine has been, and likely what led to a lot of the masking changes that I'm sure everybody's trying to wrestle their head around a little bit. And I know you guys are talking about it. And I'm personally, I'm still wearing my mask, and we're all wearing masks in our healthcare facilities, schools, and those places at this time. And we'll see how things transpire over the coming weeks. And I know this has been addressed by Dr. Pecoraro and the staff there at Pattonville. But when it comes to vaccines, here are the big questions, right? Number 1 is how long do we have protection? Number 2, I'm sure on many people's minds, well, I need another one. And number 3, when will all children be eligible? So the first 2, I think, kind of are together, because really, if our protection goes down, we're going to need another vaccine. But I'd say the other piece of that is we have variants. And my bet is that we're going to have a variant that potentially escapes our vaccine enough that we see more disease, and we'll need to have a variant vaccine, just like flu, right? We all get a flu vaccine every year because of truly different flu strains or different variants. So I don't know when that's going to be. It's not, I don't believe it's going to be this fall. It might be maybe next winter or spring, but I have no clue, and we'll see how that goes. Now, when will all children, and when I say all children, that means there's different age groups. I think the 6 to 11-year-olds, Pfizer will have some kind of approval maybe in the fall at some point. Pfizer came out with a New York Times article a week and a half ago suggesting they would have 2 to 11-year-olds submitted data to the FDA by September. I don't know. We know the 6 to 11-year-olds are being enrolled in Pfizer vaccine trials already, if they're not already completed. So I wouldn't be surprised if Pfizer actually has vaccine eligibility for the 6 to 11-year-olds before kind of October, but we'll wait and see. So all children down to 6 months of age, I think the youngest, the 6 months to 5 years of age, likely won't be eligible for vaccine until early 2022. And again, I think that'll be Pfizer. We all should know that, while we're vaccinating, we still are monitoring for safety. So all those people that potentially are on the call that are still like, well, I'm not sure, I want to wait. There's more data coming in. And it continues to look safe. Like I said, I got my daughter vaccinated with 15-year-old vaccinated with her first dose last Friday. She'll get her second dose in June. And I still believe very, very strongly, based on the data we have regarding vaccines for kids. And I'd say I think it's important that we get our kids vaccinated, because I think it's another tool or another layer of mitigation that we can provide to schools. We know the educators are now vaccinated. We get our more school children vaccinated. We're just add another layer of safety. And it's remarkable watching how our case levels are coming down more and more. And to me, it's being mainly driven by vaccination. I think the weather's helping, but there's no doubt vaccinations helping. As a matter of fact, I think today or yesterday, I think there was only 45 cases reported in St. Louis County, which is one of the lowest numbers we've seen in months, with the level of testing that we can do now. All right. So please, if there's questions on vaccines, please go ahead and put them in the chat. I can go back to them. I don't see any currently, but I'm happy to answer them if they come up even in the middle of this. So I want to talk about COVID-19 in schools. I want to just walk through what we know, and I'm going to show one paper out of Utah, and then I'm going to talk about the work done here with you all, as well as kind of the initial publication that came out in March, and then the bigger project that occurred in January through March. So first off, school-based transmission study in Utah. This was done out of 20 public elementary schools. A few big points to remember with these sorts of projects. Number one is, at the time of the project, December 3rd to January 23rd, is at the height. So the most cases on a daily basis in Utah, and frankly, in St. Louis as well. A number of 40 to 95 per 100,000 is a lot. Let's just put it is a lot, where most people are saying, why would you even try to have school? Well, we were trying to have, not trying, we were having school safely because all the work that the administration at Pattonville and other schools in our area have done, as well as in Utah. So that's first off, a lot of cases. Number two is they found cases and then they got told of contacts. And in this setting, a contact was anybody in the classroom. They didn't even, that this 728 is all, and they tested them, and there was only 5 that were positive. That's a less than 1% transmission rate. That's incredibly low. No one would have expected this. If you had asked me this March of 2020, I would say, no way. I'd have been like, Tim, you're crazy. That is not true. And I would have been wrong. And so because of the things put in place. In this, there was 4 students and 1 teacher. Now, if you look at the quarantine, so quarantine contacts is those who are in 6 feet for greater than 15 minutes. And remind you, these classrooms were mask on mask, meaning mask cases, mask contacts. Only 3 were positive, 3%. Now, if they were positive and they took it home, a lot of the households, 3 of the 5 households were positive, 6 of the 8 household members were positive. So we've learned that you bring COVID-19 into your house, there's a greater risk of getting transmission. That makes sense, right? Close living quarters, you eat together, do everything together. Now, the other thing to be of note in this study that's kind of buried in the fine print, one might say, is starting January 4, 2021, they only quarantined if the cases or contacts were not masked. So there was not even modified quarantine. So I think this is more of a story going forward, because of their 111 contacts tested, nobody was positive. And again, this is another important piece. The students were at a meeting of 3 feet apart. So I wanted you guys to be noted, this is elementary schools. So what we did in Missouri was more schools, and here's what the project was about. So we set up this project between St. Louis and Springfield, where we were looking at how do we keep children safe in schools. Let's look at the mitigation strategies, the distancing, quarantine policies. So as you might recall, in November, the state said that local health departments, so at the county levels, could adopt quarantine policies that included if a student or even a student and teacher was masked and they were a case, and they were in contact with one of their close contacts and they were masked, that mask contact didn't have to leave school, that they could be in what we called modified quarantine, that they could stay in school. Now, in St. Louis County, we did not adopt that, but in Springfield, they did. And so we could look at the differences between the two. So we did a pilot investigation. Many of you might have remembered this. I think I came on and talked about the pilot. I wanted to show you the final data. I talked about, how I want to write a song about McKelvey Road and how I was on McKelvey Road a lot. And I still think about that every day. And you'll notice in my background, I have a unicorn, because during this pilot, the CDC bought a unicorn to think about how this project would go. And we now keep the unicorn as our kind of mascot. The thing about this study was, again, we had high rates of disease. So 50 to 70 per 100,000. We had the different mitigation strategies, and we based it on the great work being done at Pattonville around contact tracing. And we got the contacts and cases, and we did testing, and we did a lot of testing, which was super important, because at the time the narrative was, well, no one's tested these asymptomatic individuals. So that's what we did, as well as doing a lot of interviews. And what did we learn? Well, I want to just show a couple of big points. Number one, we had rare transmission. Remember, Utah found 3%. In this study, we found 2%, and the transmission only occurred in elementary schools. While we had our most cases being in the high school age group, we did not see transmission in high school or middle schools during this project. In Springfield, we had 21 modified quarantine students who were tested, and none of them tested positive. So This again demonstrated how safe school can be with a testing approach that was extensive. So the full investigation started in January, and we had three big school districts, or three school districts in St. Louis and three school districts in Springfield area. We used Rockwood, so that would match up with what Springfield would be for them, and then Pattonville with another school district in Springfield Green and University City. This was important. It gave us more numbers, more testing to say, okay, is this really true? Are we still seeing this low transmission? So this pilot, now this full project went from January 25th to March 19th. I can't thank you all enough for allowing us to do this. And we used a lot of lessons from the pilot to improve the investigation and make it more streamlined to get the testing. We actually had a central testing site at the central office. And we did, the CDC folks who were here got to experience some of the lovely St. Louis wintertime weather that made this more challenging at times, but maybe more fun in the end. The other thing is we went into classrooms. And so I think we measured probably 50 classrooms in the Pattonville School District to see where cases were and where contacts were to show the safety in these, which have been very impactful and work that's ongoing. I'll show you that. So just to give you a sense of the full project that included both Springfield and St. Louis, we had 134 cases, 720 contacts. Now, should say Pattonville, I apologize, 8 possible school transmission. And among the Pattonville, this should say Pattonville again, we had 17 of 29 cases participated, 118 of 167 contacts participated and underwent testing. And there was 0, again, no transmission events were found in Pattonville. It should be noted that in this full investigation, there's some sequencing data that was sent to the CDC, and this number likely will be revised that the possible school transmission is lower. It's probably more like 4. So you can see that the percentage transmission in school environment in these schools, your schools, is rare. And it is safe. And this included investigations that included athletics, extracurricular activities. And what we found was in some of our positives that were not transmission events, they were in the things around the school. It was the sleepover. It was driving to school with a group of people. It was these other settings that led to it more than anything in the school. School's a safe place. And it continues to be. And now you add vaccinations, it's even safer. So lastly, I'm going to talk about a couple of different things. We have the school classroom measuring. This is actually what it looks like. I mean, it sounds simple. I kind of laughed, like, really, we're just going to go measure some schools. No. This is in-depth drawing with coordinates, measuring to really look at it so that we can kind of create these GIS maps, where cases are, where contacts were, where transmission might have been. So I'm really excited about this project. Lastly, which I don't have on the slides, we also did some surveys of parents and families about, 1, did they follow quarantining? Like, did they really stay home? And 2, what was the kind of behavioral social impact? So we asked some open-ended questions, meaning like, how did your student do during this quarantining? And I can tell you right now, my youngest daughter, the 15-year-old, got quarantined the Wednesday before spring break and could only go on spring break for about 4 days. And she actually thought it was her fault. And that was unfortunate because it was a school-based. And as a father who knew how safe schools were, we're in the Kirkwood district. It was tough. It was tough to say, look, no, it's not your fault. This is what we have to do. But in the end, knowing hopefully we'll work on the quarantining. But one of those ways is obviously through vaccination. So I'm going to end with a new project really quick that we just have gotten started, which we call Safe Return to School. And it's affiliated with a program out of the NIH, or the National Institutes of Health, providing the funds, that stands for Rapid Accelerating Diagnostics for Underserved Populations. We know that in many populations, especially in our African-American communities, people of color communities, testing hasn't been what it should be. There's been access problems, not being able to get it, not wanting to get it. And this project is really to try to increase more access to testing. And just briefly on one slide is we're now offering currently free saliva-based COVID-19 testing that's available. That's going to be available from now throughout the 2021-2022 school year. That's the plan. Now that could change because of case rates go down, but we will be able to pivot. But currently the plan is to provide this free testing. There's a number that I think was sent out that you can call to get scheduled for it. And there's ability to get tested Sunday through Friday. We will also have some of the schools within 5 school districts in the St. Louis region. Some of these schools will be offered for their students and staff weekly testing that is all voluntary. You don't have to do it if you're in one of those schools. And we're going to basically answer the question, do we need to do such weekly testing to help provide provide safe schools? Now, our hypothesis is we don't need to do that. We just need to make sure testing is available. And it should be easy, right? Like it should be, you can walk in or call somebody up, get a free test, have it done, and get a result within 24 hours. That's what we're going to be able to provide. So we hope that we help with that. The last thing we're going to do is there's going to be a number of listening sessions to try to understand from the school community, the administrator, students, staff, others, what are barriers to in-person school during this time, testing, vaccines, so that we can make things better going forward. So with that, I will end. Happy to answer any questions. And again, I can't express enough my thanks to you, Dr. Pecoraro, your staff, others for supporting us. And really, honestly, you guys have changed national policy. And that's no doubt. The policy changed because of the work done and your guys' efforts with us. So thank you, thank you, thank you.
Thank you very much, Dr. Newland. There is one question. I think I'll answer this first one. But as a reminder, the phone number for testing that was sent in our district e-newsletter that was sent out yesterday. So parents, if you didn't get a chance to see that, check your email, and we'll continue to publicize that. One question that's up here is, what will class sizes look like for the upcoming school year now that most of the remote children will be returning? These numbers are for smaller class sizes, and I think they're talking about the study there where class sizes remain small. So one thing I'll tell you currently right now, so 30% of our kids are learning virtually. Next year, based on the responses from parents, we're going to have about 3% of our kids that are opting for virtual learning. Even though 30% of our kids currently are virtual, we also have about 30% of our staff that are teaching 100% virtually. So from a class size perspective, once we went back to 5 days a week, our class sizes were pretty typical to a normal year, especially at the elementary level and at the secondary level, maybe a few kids less. So class sizes moving forward next year would look pretty typical as they would during a normal year, but we will continue to utilize all the mitigation strategies that we know that we need to do. We've been able to continue to have 3 feet of distance between students in most cases. We've used some physical barriers. Now, I'm not sure we'll continue to do those next year or not. I think a lot of that is going to depend on the guidance that we get from individuals like Dr. Newland and the CDC and the St. Louis County Department of Public Health.
Yeah, I will just say too that, one of the things that we're going to continue to do is we're going to continue to evaluate schools. And I think that's part of the ongoing projects and why, this partnership continues to be important. Because I think number one, not only does it inform nationally what's going on, but it informs locally, right? It's going to help us continue to understand. And I think this goes to this next question about, what about this current mask mandate drop and how it affects school children who are not yet old enough to be vaccinated? And should the schools keep the mask mandates and all the mitigation processes to protect them? I mean, I think as of May 18th, by the way, for some reason today I want it to be May 20th. I don't know why, but from May 18th, 2021, I think, we keep these things in place. I mean, yes, we've dropped the mask mandate for vaccinated people in some regards, but let's be clear, not everybody's vaccinated. We know the younger kids aren't vaccinated. I told you where we've seen some transmissions in elementary schools. So I think the key will be to continue the masks for now, but we have the summer and we're going to continue to see stuff over the summer. We're currently going to try to do some work, and I'm telling you guys this, hoping we can do this work, is compare some masked summer schools versus unmasked summer schools. Now, it gets at the numbers won't be the same, but if we see unmasked summer school with transmission rates much higher, I think that gives us more credence, especially in the unvaccinated groups, to be in masks. And so I'd say as of today, my opinion is, we're probably most likely, I'm for the mask in schools, just like where I work, we didn't change. I mean, I still walk in with my mask on. I still go through everything. If someone comes in my office, we're still wearing masks. Now, are we going to let that go a little bit? Probably, but there's a lot of work still to be done and to understand.
All right, Dr. Newland, I don't see any more questions. Again, oh, we do. A question, will students have to be vaccinated if there is one available? No.
Yeah.
Students will not be required to be vaccinated.
Yeah, I mean, I think, and I'll just add, I think, you know, if you've heard me talk, which unfortunately probably many of you have, I'm sorry, we'll all be glad we don't have to see me, but I will say that, you know, we have never mandated influenza in schools, influenza vaccine in schools. And as much as an infectious disease doctor, I'd love to see, you know, they do that. I think we have to meet people where we are. I will say, and I should have said this on my mask answer before, we should all be prepared that if we go into school and have a time with school without masks, we should all be semi-prepared to put them back on, because there are no doubt that they're effective. I don't know about you guys, but I haven't had a cold in 15 months. I mean, it's amazing. So like, you don't know we're going to pick it up. So like the mask would not only help that. Now, again, I also get tired of them, but I had no problem when I went to Deerberg's on Sunday to throw my mask on, because I don't know who I'm going to be around. And I don't know, for 20 minutes in the store, I kind of don't mind it. And I like how healthy I've been. So
I would like to add to, just for informational purposes, we have 2 vaccine clinics that are going on for our kids. This Saturday is the second shot for the 16 and older group at Pattonville High School. And we did send out information yesterday for 12 and older. June 3rd is the first shot, June 24th, the second dose. And I think we had over 200 people sign up in the first 6 hours, which was great. And I know Pattonville Fire Protection District, I think as many people that sign up, we're going to be able to accommodate them. And then we're going to look to probably do another vaccine clinic over the summer, just so anyone that wants the vaccine student-wise had an opportunity to do that. And just so you know, that's open, not just to Pattonville students 12 and above, but to families as well.
that's awesome. That's awesome.
Okay, guys. Well, I appreciate everyone joining us again tonight. Thank you very much. And Dr. Newland, as always, we appreciate your expertise, and we'll probably be utilizing you again next year to come and give some reports to our community. We really appreciate it.
I look forward to it. Thank you so much for everything. Thanks for just being leaders in this.
Thank you. Everyone have a great evening.
Thank you. Bye-bye.